Hey guys, it's Dr. Hardegree. Today I'm going to show you guys one of our clinicians at Soundview doing a cat neuter on one of our assistant's cats. Be warned, there is some graphic stuff in here. We're going to be cutting out some testicles, so be aware of that. So here we go. So as you can see, we have the cat positioned in dorsal recumbency. Dorsal recumbency means the dorsal side is the one that's down. We have cleaned and prepped everything to make sure that we have a complete sterile field. And as you can see, we've actually picked away part of the hair on the scrotum itself. And so here I'm making a very small incision into the scrotum. You want to make it on the most ventral aspect. Is what we're trying to do, because we are actually going to end up leaving this open. You do not close cat neuters because you want any kind of wound or any kind of fluid or anything in there to drain. And so we're continuing to make the cut, a very, very small incision, as small as you can, because again, we're not closing it. And then you actually work the testicle out of the scrotum. And so you can see there that I have taken the testicle out of the scrotum. Right now I'm grabbing some sterile gauze, and I'm actually going to pull away at the fascia. The fascia is the connective tissue surrounding the testicle itself. And so as we separate that fascia away, you can see it slowly starts to move a little bit further out, and you can actually pull the testicle away from the body wall itself. And so that's what I'm doing currently, is I'm actually pulling just a little bit of light pressure there to straighten that cord and lengthen it a little bit, getting that completely out. And then what we're going to do is that in a dog neuter, we would actually be using some other form of hemostasis or stopping the bleeding, but in this form, we're actually going to use autoligation. And what autoligation is it's actually auto meaning self and ligation meaning stopping. And so ligation, so we're going to autoligate, meaning that we're going to tie it on itself. And so actually tying the spermatic cord completely on itself, creating a little knot there with the hemostats. And so you can see I fold it over, I stick the testicle back into the center jaws of the hemostats, and then I make a cut. So testicle is removed, first testicle gone. Right now the spermatic cord is knotted just around the hemostats, and so I actually move them with a little bit of the clean gauze to move that knot down and tighten it. And as you can see, there's the knot in the actual cord. And so then we release, because we know it's knotted. We see that it's not bleeding, and then it gets sucked back up, and then you're done with one side. And so then we repeat the exact same process on the other side. And as you can see, this video is only 5 minutes, and so this is a fairly quick procedure. We actually don't even have this animal intubated. We use sedation for these oftentimes rather than full gas anesthesia, because the procedures are so quick. And we actually use something called a local block, which means that we inject lidocaine directly into the testicle, which even reduces pain more than normal. So they don't often need gas anesthesia. So as you can see, this one took a little bit less time, and so we've actually gotten it completely out of the scrotum. Right now we're just trying to pull that cord to loosen it a little bit so we have a little bit more to tie off. So testicles hanging there, you can see it. And then make your knot. Okay. Ooh. Obviously that one was a little bit more difficult. So we want to stretch that cord just a little bit more. So we're making the knot around, put it in between the jaws, clamp down on that hemostat, and then take your scalpel and make a cut. Whenever you make the cut, you do need to make sure that you get the entire testicle out. We don't want to leave any testicular remnants, because that means that testosterone is still going to be in there, and that can cause problems later on in life. So tightening the knot with that sterile gauze again, getting it down, making sure that it is very, very tight so it doesn't come unraveled. And then, see the knot there. Make sure everything is tight, very tight. And then release. Check for hemostasis. It's not bleeding, great. Then it gets stuck back up, and then we're done. So, and then you do not close these incisions like I said. So you just leave them completely open. And that's a cat neuter.